Welcome to this week's Magic One Moment. I'm Lindsey Wallstrom, Chief Traumatologist at Rona's Fun Lab. It is Music and Art Therapy Month, and today I'm joined by Laurie Park, who is a board-certified music therapist and a licensed creative arts therapist at Maria Ferrari Children's Hospital. On a personal note, Laurie served as my daughter Rona's music therapist while we were in treatment. Laurie, thank you so much for joining me today.
I'm happy to be here. Thank you, Lindsey.
So I obviously am quite familiar with what you do, but I would love for you just in your own words to explain to anyone who's listening what a music and art therapist does.
So, music therapy and art therapy are in their own right separate professions. We use music and art as our modality as mental health practitioners, which is very helpful in the children's hospital because we can kind of slip in there under the guise of doing something else and then be able to draw out some of the information needed to help us guide them through their experience. You can really understand a lot about a person by just asking them, like, what kind of music do they like to listen to? Do they play an instrument? Do they like to draw? We are licensed professionals. We're board certified. We go to school for this. It's very specific to what we do. It's really to use music and art in ways that are working on non-musical or art goals. So I might be teaching a child how to play the piano, but it really might be working on fine motor skills. Or we might be writing a song about their experience to just help them cope with what's going on. And it would be incorporated in play, and I would let her guide where we were going. And one of my favorite moments with Rona, and I was thinking about it on my way here. I went in on a regular day and she was sitting by the window playing with her Barbies. And I brought in my guitar and
It's guitar. I know exactly what you're talking
sat
about.
on the couch with her. And she wanted to sing Part of Your
Eggs are
World from Little
required
Mermaid.
for jumping, dancing, strolling along down. What's the word? Street. Up where they walk, up where they run, up where they stay all day in the sun, wandering free. Wish I could be part of that world.
And if you listen to the lyrics of that song, they take on a completely different connotation. If you're sitting by the window, stuck in your hospital bed, she probably knew exactly what she was doing and trying to get her message across. And I'd like people to kind of listen to that today and imagine a little one sitting by their window playing and wishing that they could be part of their world and
Yeah.
their normal experiences. Her father actually said, I've never really liked that song until today. I
Yeah.
like heard it in a different way. And music therapy has that magic ability to me and the patient or family, that outlet. And sometimes they don't even realize that that's happening. And it kind of opens the door to be able to have conversations that are so much deeper. I'm not just playing music all the time. We're using that time, let them lead where we're going to go.
Mhm.
And then we can just take off in any direction. And I actually listened to that song on my way to work today, thinking about Rona, and you will appreciate this. But the next song that came on was How Far I'll Go from Moana, which
Mm.
was her favorite princess.
Wow.
That today, you will really hear what she was trying to say and what we're continuing to try to say on her behalf, to really open those doors using creative ways, really have opportunities to use modalities that they wouldn't necessarily have thought of before. It taps into different parts of your brain. Music is one of the only things that activates your whole brain at the same time. It can elicit emotional response. It definitely elicits physical reaction. It can increase your oxygen saturation. It can decrease your heart rate. So we can use it in a way that can help decrease pain emotionally and physically, regulate breathing, um, help cope with illness, increase self-esteem, to individualize the treatment. No two sessions, no two families, no situations are ever the same. So music is really so incredible, and I see it every day. I've been a music therapist for 30 years. Um, I've had so many stories along the way. Rona is definitely one of my highlights, but I was thinking back to a lot of the other situations that I've worked with here and in other places. And music therapy is an evidence-based practice. There's a lot of research behind it. I've been involved with some of those research studies. It's so important because music therapy is science driven. And I think that it's important in the medical community to be respected in that sense.
Absolutely. And I want to pick up on that thread about the research because my sense is that a lot of people nice to have a soft skill.
Hmm.
And to the extent that a lot of child life services and arts therapy services aren't covered by insurance, there's not a billing code. And so for us to have these services in hospitals, the hospital has to fund the position through their foundation or other means. But there are several randomized control trials that have demonstrated that these are really effective techniques to reduce perceptions of pain and emotional distress. I certainly experienced that firsthand multiple times.
Hmm.
We got Rona through a procedure without sedation by using music. Um, what would you say to people who are maybe less convinced of the need for music and art therapy interventions, especially in a pediatric setting? But I'd be curious for your take on adults too.
It's the same across the board. I mean, music elicits a reaction in some form. Music therapy as a profession was only established in 1950. And it really started in the VA hospitals with veterans that had PTSD. Not many people that have ever experienced a hospital also experience PTSD.
Absolutely. Yeah.
We have a breadth of knowledge that has to do with using music in that capacity right from its inception. Now, we can also look at how music has been used as medicine, you know, throughout history.
Mhm.
And I am proud to say that the people that saw its benefits from the start really started documenting. There are specialties in music therapy that also address specific needs. There is neurologic music therapy that really focuses on how music is processed in the brain. All music therapists use that knowledge in some way, but there are very specific music therapists that can work with populations with like Parkinson's and in the geriatric population, brain injury. Gabby Giffords was one of the most famous that was benefiting from music therapy after she was injured. And so that is a very specific technique that can activate parts of the brain. I have special certifications in neonatal intensive care music therapy and hospice and palliative care music therapy because those are two areas that while I was working in the hospital, I felt like needed that extra level of intention. And so you can look for, when you're looking at the research, look at whether it's got a music therapist on their study, because I think we look at it from a little bit of a different lens. And some of it relied in the past a lot on recorded music, which was standardized for the study. We've really discovered that that's really not the way to go because people have preferences and music is going to affect them differently. Rona was pretty clear in what she liked and what she didn't like. And if I offered something she didn't like, she let me know. And that was really useful information. also a great opportunity for her to have a voice
Yeah.
and for her to make a choice. And I think that is really powerful in a situation where, a lot of your day is mapped out for you. It really offers that opportunity as well. There are a lot of places that you can look for music therapy research. The NIH is actually funding some great research right now. One of the studies that I was involved with in the neonatal intensive care looked at using live music interventions with premature infants. And it was the largest study. It was a multi-site study. It's in the Journal of Pediatrics, which was a really big deal for the music therapy
Yeah.
community because people are starting to really come around to seeing the value of the intervention that is available. We're in the process of getting a part-time position in addition, but there are so many people that could benefit. And I think that's across the board. There's just never enough people to do all the work that needs to be done, especially when you want to do it as genuinely as we do here,
Mhm.
I can say. And I really am just honored to be part of this community and have been part of this community for so long. And I look forward to being part of the Rona's Fun Lab community because I think your reach is going to go far and wide. And I look forward to being part of that mission.
Thanks, Laurie. I want to pull a thread that you've been dancing around a little bit, which
Hmm.
is that this is hard work and it's work. And it's not just, oh, I get to go in and play music with kids all day. It's really being thoughtful and how you approach it. It's using the evidence-based methods to pull out the child's experience or the parent's experience and really help them through those hard times. And I don't know that that's always appreciated to the full extent. Wouldn't it be great if we just all took it as a need for everyone who's
Yeah.
especially in a complicated health situation to have access to these services. You sit with people in their worst moments, day in and day out, hands down, I can attest. That's a lot. So what keeps you showing up every day?
It matters. It matters. It matters to the people that I'm working with, and it matters to me. And that's never going to stop me from coming. It's never going to stop me from doing this work. It matters, and there's so much more to do. And I have seen when what I'm offering can literally, it changes the tone in the room. It offers it offers a space that is chaotic, some structure because the music gives that. I also use a technique. It's called entrainment, and I am playing in correlation to breathing.
Hmm.
So I'm watching the monitors. You might not be noticing that. I'm looking at your breathing. That was part
Yeah.
of the reason why you were so exhausted because your system was aligned with hers in a way that is physical. And so when you're using live interventions, I'm playing the guitar or just singing or humming or the using the like the balmy drum that we used.
I still have one.
Yeah. I'm playing in the tempo of your systems. And that is really powerful. It aligns with the energy, it aligns with the space, it aligns with the physicality of what's going on. And then if I need to adjust it, I am doing that unbeknownst to you. But if we needed to like maybe not be as relaxed, or if we needed to get that oxygen saturation up or inch that tempo up a little bit to get it where we need to be, or if it's a really stressful situation, we might start with a more upbeat thing. And, if Rona was feeling frustrated or mad or, you know, intense, we might, start with some drumming and get some of those feelings out and then like kind of turn it into more of a structured piece. It's very appropriate to feel upset and angry and want to hit something. But then you get this like amazing sound back. The other thing that I really advocate for is really good quality instruments. I'm not bringing toys in there. I don't care how young she is. When you play a beautiful instrument and you get a beautiful sound back, you're feeling that. You're getting a tactile experience, sensory experience. I have beautiful big rosewood tone bars that like they feel good and they weave their way into your body
Mhm.
in a way that is comforting as opposed to a lot of the things that are happening to your body that are uncomfortable.
Yeah.
And then we all have a heartbeat. We all are organized by rhythm, the way we breathe, the way we exist. I've used stethoscopes with kids that want to listen to their heartbeat and then we play it on the drum. I have a special stethoscope that can record your heartbeat and we can infuse that into a song or just use it as a legacy item that can live on. And it's really, really powerful when you get down to centering yourself with your heartbeat and your breath and relax. When you're relaxed, your pain is decreased. So these are all techniques that we can use. The other thing about music is it can be a completely passive experience. You don't even have to be conscious.
Yeah.
And I can provide a musical experience and you can watch the monitors shift. It can also, you know, give you an outlet to say what you can't say yourself. I had a mom whose daughter was nearing the end and she asked me to create a very specific playlist for her to be able to play in her daughter's room. And when you and it was personal to them, but the songs were, really broad. It was a way for her to tell her daughter the things that she just couldn't bring herself to say. And so that's pretty powerful to give that outlet to somebody that might not be able to do it on their own. We had another experience where we had one of the kids in the hospital. This was years ago. This was one of the early days of me really wanting to dive deeper into palliative care. She was a teenager, young teenager. She was going to be in the hospital for Christmas. She'd had a transplant. She couldn't come out of her room. And so she wanted to make a Christmas CD for her family. And she was very talented. She rewrote some of the Christmas songs to be funny. And we worked on this for like the whole month leading up to Christmas. And she had songs that were special to her family. Her mom had actually passed away of cancer. Now she had cancer.
Mm.
And so she included that. She curated this collection of songs. She worked with our art therapist and designed the cover of the CD. She asked for wrapping paper, burned CDs, which is what we did at the time. And she gave those to everybody. She gave them to the cleaning people. She gave them to food service. She gave them to her family because she couldn't go out and buy
Yeah.
gifts. This was such a treasure. And years later, she was in the hospital again. And we ended up including some additional songs because I'd seen her over a period of years. And we ended up having a CD release party. And we had a big party where she, signed autographs. And one of her wishes was that be famous. She wanted to meet famous people. She wanted to be famous. And so she felt famous that day. And I think that was really special. And now her family has this collection of her songs to live on forever.
Yeah.
And, that was kind of a long-term project because it took place over years and years and years. But it was really valuable to her. It empowered her. It made her feel so good that she had something really special to offer to her
Mhm.
family, and
Yeah.
they have it
Yeah.
forever. Yeah.
So
I have a million of those stories, but
I'm
we
sure you
don't
do.
have
I'm
that
sure
much
you do.
time.
Yeah. Say,
But,
um,
it's where the science meets the magic,
yeah. Yeah.
and they're really one and the same.
Yeah. That's true. It's
Yeah.
very true. Well, it's a perfect little segue because my last question for you is I'm going to hand you a magic wand that you can wave and wish for whatever you want to come true. The only rule is that it has to be for a change in how we deliver pediatric care. Could be for the patient or the caregiver or providers, actually. What would be your magic wand wish and why?
My magic wand, I think I would really want to have people understand palliative care more so that they would take advantage of it. I think sometimes we wait too long. And obviously the funding, if we had more funding, we would be able to provide more services and especially pediatric palliative care because I think people are afraid. I think they're afraid to think that if they sign up for palliative care that it's over. And it's really the opposite. It's really the opposite.
Yeah, it
It's
is.
really
Yeah.
a gift and enjoying every moment and knowing, I mean, most of us don't know. And so we let a lot of time go by and we just, wait till lunch comes and we wait till this and we make our lists, of which I have many. But kids like Rona teach us that, I'm going to play. I'm going to set my dolls up. I'm going to do this. I want to, you know, she's even created things for other children. She
Mhm.
was inspired by being here. She really advocated for herself, even though you were an incredible, incredible advocate. And you let her lead the way. And I think that's really important. And in palliative care, especially pediatric palliative care, I think to take away the fear and to really be present in the
Uh-huh.
moment and take advantage of the little things.
Yeah.
It's the little moments too. It's not every moment doesn't have to be an extravaganza, but every moment is precious. And I think if people understood pediatric palliative care, they would understand what that really means and providing comfort and providing caring and, maybe having to bend the rules a little bit, like what's the big deal?